Thanks very much. It's a pleasure to be able to be here and to have a role in this wonderful event. As you all know, an important part, a critical part of the climate crisis is its impact on human health. So if we think about the climate crisis historically in terms of how our understanding of the climate crisis has evolved, it certainly started out with worrying and learning about some of the physical consequences and the consequences of those of issues like sea level rise and global warming. But it quickly became apparent that many of those consequences were going to have direct human impacts, and many of those impacts transpire and show themselves through health. So understanding better the role of health and climate is of critical importance. Not just understanding how climate change impacts health, but also making sure that we understand how we can take interventions so that those impacts of climate change, which are undoubtedly going to be happening, which are in the cards, they're going to be getting worse, how we can get ready for those, how we can adapt our global health systems to make sure that our citizens are protected to the extent that they can, and how we can think about various other measures to get ready for worsening climate change that is already upon us but will be getting worse. Fortunately, we're able to have a wonderful panel or a wonderful discussion today with Dr. Vanessa Kerry, whom I will introduce in just a moment. I do want to say just one quick word of thanks to Louise for our participation and the work that we've been doing with the Harvard Global Health Institute. We have it's been a very gratifying collaboration so far. The Institute does work that goes outside the climate area, but climate is obviously one important field, and we are fortunate to share between us some Harvard Climate and Health Fellows that I see one of them nodding right now, and it's terrific to be able to share that with between the Salata Institute and HGHI. So let me introduce, without any further delay, let me introduce our two speakers, or our two panelists today. So first of all, Dr. Vanessa Kerry is the Director of the Program in Global Public Policy and Social Change in the Department of Global Health and Social Medicine at Harvard Medical School, as well as Associate Professor of Social Medicine at Harvard Medical School. She serves as the Special Envoy for Climate Change and Health for the World Health Organization and is a physician at Mass General Hospital. She's the founder and CEO of Seed Global Health, a nonprofit that invests in health system strengthening by training health professionals in resource-limited settings. Moderating this session is Nico Dominguez Carrero, a junior at Harvard College pursuing a concentration in environmental science and public policy with a secondary in global health and health policy. Nico is also a staff writer at the Harvard Crimson and is currently a research assistant with the Johns Hopkins Center for Health Equity. Please join me in welcoming Vanessa and Nico.
Hi, Nico. How are you? Good to see you. All right.
Forgive the awkward entrance. I was enjoying the heat. This is really an unusually cold day for April for me.
Yeah, and you'll excuse me for having my questions. I'm an undergrad, so I'm good at having my homework done.
I probably should have my notes, but I'm going to go rogue.
Okay, great. Well, thank you so much, Dr. Stock, for your opening remarks. I think personally on the undergrad side, I've been really struck to learn more and more about climate change and its impacts on health. Definitely when I came into college, it wasn't an intersection that I knew about. So I'm really curious to know about your climate story. When did you get started doing climate change work? How have you seen it impact your patients, and what brought you here to this moment?
Well, thank you. And I'm really excited to know that as a student, you are engaged in this space, because this is a growing space of understanding. And without question, it's been a long-standing space, though. A lot of my colleagues and our colleagues have been doing this for years, trying to really advocate and have people understand the deep intersection of climate change and health, and how climate change is impacting our health every day. My personal journey to this was one of serving as the CEO of Seed Global Health. And what Seed does is we partner with governments in sub-Saharan Africa to build stronger, more resilient, responsive health systems to the needs of countries by training healthcare workers. And we've been doing this for over a decade. We've trained over 47,000 doctors, nurses, and midwives in 7 countries in partnership with sub-Saharan Africa. I am deeply honored that Minister Demby is here from Sierra Leone. He is one of our chief partners, as is the country and all the midwives in that country, where we are working to train midwifery to respond to the really unfair, unacceptable, and preventable loss of life of women in pregnancy and childbirth there. And through the partnership with Sierra Leone, just as an example, through a year and a half of dedicated collaboration to train midwives to the big killers of women, working in the McKinney district and the Bow district. And McKinney district in Sierra Leone has 44% of the country's maternal mortality. Minister Demby, correct me if I'm wrong. And I should say they used to have 44% of the maternal mortality of the country, because after a year and a half of education and training in partnership with the School of Midwifery there, we were able to reduce maternal mortality by 60%, which has been sustained for over a year and a half now, 2 years. And for months at a time, actually, we saw no deaths. And that is a remarkable commitment of the country and a belief that we can, with the right resources, the right plan, and going behind a national plan, really shift what happens to people. So as we were doing this work in our countries, though, what we found was that climate change was making it harder. Malaria, and I know Dave, our malaria chief, is here and has already spoken to you about this, but our experience was, rather than having 2 patients to a bed, which is already ridiculous in a malaria high season, we're seeing 6 to 8. We're seeing children die again at higher rates than they should be because of malaria. We're seeing flooding. We're seeing cholera outbreaks. And in the countries we're working in, we've had to respond to cholera emergencies now in 2 of our 4 countries that we work in. Ebola outbreak happening in Uganda that we had to respond to. We're seeing floods. We're seeing drought. We're seeing malnutrition. We're seeing things that we were making progress with as a globe. We're starting to lose it. And so what we realized was that our work is getting harder. And then you couple that to the fact that there's already a global shortage of healthcare workers. We are less prepared then for the challenges we're seeing coming down the pipeline with climate change. Climate change impacts every single aspect of our health, both directly in terms of maternal health, in terms of our, the maternal and child health, risk of stillbirths. The study just came out. We're seeing it in terms of mental health burdens and anxiety, mental health breaks. We're seeing it in terms of the non-communicable diseases, stroke, kidney disease, cardiovascular diseases, pulmonary diseases, and we're seeing it in terms of what's happening in, obviously, the vector-borne diseases and communicable disease. It's worth noting that more people die a year from air pollution. 8 million people die a year from air pollution a year. That is more than we saw in the entire COVID pandemic. COVID pandemic shut our world down, panicked our governments, panicked our economics, and everybody freaked out and responded. Why aren't we doing the same for what's happening in climate change? So this is a really real battle, and this is where we got involved. And so my particular journey to the role I play was that I was at every 5 years there's a conference on health workforce thrown by the WHO. And I had an opportunity to meet with Dr. Tedros, and I said, you need to be on the front lines of leading on climate change right now, from as though it is the COVID pandemic. And we got in a discussion about what this meant and what it meant for addressing the gaps of workforce and these pieces. And we decided, let's see what we can do if we create this role and we go out there and we try to leverage. But make no mistake, whether I'm CEO of Seed Global Health, whether I am the special envoy, whether I am here faculty at Harvard or I'm a mom, the battle's all the same. Health is fundamental to our existence. Strong and health systems are critical to our ability to survive and to have not just good health, but economic growth, stability, all the things that we're seeking in the world today. Long answer, but big question.
Yeah, of course. I totally agree that I feel like as a student, it was incredible to learn about this huge history of climate change and health. But I think we are at a very interesting moment when it's becoming increasingly important on the global agenda for health and for a number of sectors. I know this year, the Conference of the Parties, the COP that was held in December of 2023, which I believe you were also at, had its first day of programming specifically around health. I think also maybe $1 billion in funds are specifically earmarked for health directly, even though we know that health is sort of implicated in a lot of these other places where money is being funneled into. But this COP was really important because we have this new funding source, the Loss and Damage Fund, among others. So can you speak to sort of what does it mean now to have health at the COP, to have this new funding, and what does that mean for how we're integrating health into the larger climate change discussion?
So it was incredibly exciting to see health be a thematic day for the Conference of the Parties for the first time ever. And that really reflects the work of a lot of folks in this room, a lot of folks in our ecosystem who've been advocating for it for years, but it finally hit a drum roll big enough that it became a day of health. And it was exciting for a number of reasons. One, it was anointed as important enough to be a part of the conversation. Two, it was on the third day of COP. So it was after the 2 high-level political days. It was the first thematic day, which was really a statement of its importance and its primacy because it meant a lot of the world leaders also got engaged in this conversation. And this COP28 was also exciting because it's the first time the word fossil fuels was actually used as, a source of climate change. Now, it was sort of a contributing to, and there was a commitment to transition out from fossil fuels, but there wasn't a phase out. And the problem is, even if we stop all fossil fuel use today, we are still going to see changes for a while before we would start to rectify. So it is urgent that we get very serious about a rapid transition or a phase out of fossil fuels. It was exciting because you pointed out $1 billion was committed to climate and health. There was $770 million committed to neglected tropical diseases and an announcement of a $30 billion fund by the UAE to spur investment and to attract billions more to sort of respond to the climate urgency and to adaptation and resilience. And all that was really momentous. 150 countries signed on to the declaration or the ministerial declaration for climate and health, which was a statement of our consensus of that intersection and endorsement of the realization that there's a cross-section. Exciting start, but a long way to go. Because of that $1 billion in climate change and health committed funding, over $800 million of it was pre-committed, pre-funded, pre-earmarked, so we're not talking about new money. It's also being dictated by the donors, not by the countries or by those that actually want to spend this money in a versatile and flexible way to answer the problems that they need. And so that remains a very real challenge. You have a loss and damage fund that was announced on day one, super exciting, except for the fact that we have to spend $366 billion a year just to begin to close the adaptation and resilience gap. That fund walked away with $750 million with an M, not a B. So we have a huge funding gap that is not getting mobilized in the right way still. And frankly, $30 billion dedicated to spurring investment is actually also about making money again. So we're not really looking at this from an equity lens in the same way. We're still being driven a little bit by how do I benefit from this? And so I think there's work to do around the global consensus about the threat that we have from climate and health and how do we invest in global public goods, and we can talk about that in a little bit. But that remains the fundamental question here, is that we are in a shared threat. Yeah. And so we need to get very creative about how we're going to meet that threat.
And to that point, you spoke to sort of the plethora of impacts that climate change has. It creates new threats. For example, extreme heat is something that I've looked at in my coursework and its impact on farm workers, but it also exacerbates existing threats, like you said, like food security, for example, from floods or increased rain. How, with this very limited pool of funds that you have spoken to, with that very few money, what do you think we should be focusing on? Should we focus on healthcare, on the direct impacts, or should we be thinking more systemic resilience, these broader sort of concepts that get thrown around?
I'm smiling because I'm going to give you a very biased answer. Okay. I personally think that investing in strong, resilient health systems, just period. If you just say, if we put primacy and value to health first and foremost, I think from that unlocks every other benefit that we possibly need. Health is fundamental. It is fundamental to our ability to care for our children. It is fundamental for our ability to go to school. It is fundamental, though, not just to how we exist on a daily basis in this world, but it turns out it's fundamental to our economic growth. So there's lots of data that shows that healthier populations actually have larger GDP growth. On a macroeconomic level, we see on a microeconomic level that households that lose their health actually lose access to running water, have to move, children have to drop out of school, there's major losses in income. So the human security is very attached to our health. There's also migration now. We know there's going to be 1.2 billion climate migrants by 2050 from climate change. A third of those are probably going to, and about 132 million that are going to fall into poverty in the coming short time. And a third of those are going to be from the impacts of health. So investing in health, to me, is a way for us to manage multiple problems. How do you invest in health? Our globe continues to invest in health through the lenses of problems, right? And forgive me for some folks in the room, but it's an HIV problem. It is a maternal child health problem. It is a infrastructure problem. It's not. If we took the approach that we were going to invest in strong, resilient health systems founded on a health workforce that can meet all those burdens of disease, that is possible, we actually solve multiple problems. It turns out strong health systems with early warning systems, a workforce that can meet burdens of disease, and for example, family medicine physicians can meet 80% of the problems we see in communities and all health burdens. That's a pretty profound investment right there when you think about scaling that up in terms of what we could achieve. It turns out that you invest in prevention, actually you can save money. We're spending hundreds of trillions of dollars a year managing non-communicable diseases across this globe. But if you could get on the front side of that, it'll cost us less, it'll be less lives lost, and it'll be less loss, morbidity, and contributions to economic growth. And so if we could start to reorient ourselves around universal health coverage, around primary care, and around what strong, healthy systems are, then you can do pandemic preparedness, you can do climate change and health, you can meet the burdens of maternal child health, you can meet your vector-borne diseases, and when you have a cholera outbreak, you can pivot and respond to cholera. So you have this capability, but we don't invest that way. So we're making it very hard for countries like Sierra Leone to take care of its population because we're constantly saying, fund this, fund this, fund this, and we're not getting behind national plans. And so I think that that's how we could make the money go farther. We also need to recognize that investing in health has actually got a very positive return on investment. And I think there's a way for us to reframe the value of health if we dive into the evidence and reframe it on a shorter order. And that's a project that we're going to be launching because it's going to be very important if we're going to close some of that funding gap to have people understand the immediate savings that are seen in a way that more money can come into the system.
You mentioned, there are there's a lot of work that needs to be done in terms of healthcare system resilience. In my own work, I was a community health worker here in the States during the pandemic and at Johns Hopkins, the Center for Health Equity. No problem. Yeah, I think more about the community health workers who are still in these communities working there. And I was able to publish some research with Dr. Chidima Ibe where we interviewed community health workers on their own social determinants of health. And oftentimes we find that we're asking very vulnerable people to support other vulnerable people, which is, this sort of the dual strength, right? They have this contextual knowledge, but oftentimes these programs aren't well funded. But we know that they have such incredible local knowledge, and there's this increased interest within the healthcare space to have local participatory interventions. So when we're thinking about healthcare resilience and we want to do this equitably, we want to do this more effectively because we know that including people like community health workers in our intervention designs increases intervention efficacy. How do we do that, without enough funds sometimes to support these people and when they're dealing with multiple crises at the same time?
I think I'm pausing because I don't want to keep beating the point, and we do need more funding, right? We need a change in frameworks, especially in this country. Community health workers, for example, could be in extraordinary service to the vulnerable populations in the United States. And we have great inequity within our country in terms of the health delivery that can happen. And community health workers could be a very critical bridge. Community health workers are an important bridge anywhere in the world in terms of understanding what's happening in communities, serving as early warning systems, screening, access to formalized health care, and the ability to really help address some of those core primary care needs. And they are going to be the front line in many ways of our surveillance, of our responsiveness to climate change and health, our pandemic preparedness. And so we need to build out, I would argue, that we need to build out, again, health systems that are founded on a health workforce. People always get overwhelmed by how do you invest in a health system. And if you look at the WHO, there's 6 main building blocks of strong health systems. If you look at the climate change and health, building climate resilient health systems, there's 10 major building blocks. But I'm going to argue it starts with a healthcare workforce that is well distributed, well trained, protected, and able to meet the burdens of disease that exist in a country. And the reason why is that your healthcare workers will triage for you the most important next levels of investing in health systems that will save the most lives the fastest. And again, I'm going to give Sierra Leone as an example. When we started our program in Sierra Leone, we did a needs assessment to understand what women were dying from and what the greatest risks were to women and children in the country, in the places that we were working. As we targeted that, while we identified education opportunities, we also identified opportunities to make the blood bank more robust or to provide certain pharmaceuticals. But this came from the health workers themselves. If we had X, we could do Y. And when we responded with those investments and layered out those pieces of the health system, that's how we got to the 60% maternal mortality reduction. And so if we do that, if you empower healthcare workers, they will tell you, Chansey Banda is a midwife who worked in a district in Malawi during the big cyclone Freddie that came through. And the bridges washed out such that services couldn't be provided at one of the facilities. She went to her district health office and she argued for the need to be opening emergency services for women so that they were able to get the services they need. Because it turns out when you're pregnant, you're still going to be pregnant even after a cyclone, right? You're still going to have that child. And so she helped advocate for the services. She helped create the services that needed to be happening. As a result, for the months until the bridges were repaired, no woman or child died who visited that facility because the services were opened again. That started with a health worker. So if we take that approach and we invest in this, the rest of the system will triage out and be supported. The metrics we need for our data information systems will be informed by our healthcare workers.
You spoke to Paul Farmer and accompaniment, and I was fortunate enough to take his class with him in 2019 when I was a first year many, many moons ago. But when I think about accompaniment, I also think about the countries who are trying to access these funds. So circling a bit back, but there was this very interesting report by the World Resource Institute that sort of went through a lot of the barriers that countries face to even accessing these funds, right? The process can take multiple years, hundreds of thousands of dollars. These are countries that are, already being impacted by climate change, may not already have enough resources of, all the problems we've mentioned. How do we apply accompaniment to that situation? How do we support countries in being able to actually measure these things so that they can make a compelling case for investment?
I think it starts with just, I'm going to say we. I think a lot of the people in this room, though, probably are already there. But I think we need to change the understanding that and to understand that countries and communities understand best the challenges they face, the solutions that are needed. And when you look, so a couple things. One, when you look at funding for climate and health, or for, about 2% of all adaptation funding right now, 2% of all climate funding is going to adaptation, and 0.5% of that funding is going to climate and health. So we have very small dollars that are going into supporting this space in the first place, which is just one challenge. But when you also look at it, a lot of that money is not flexible. It's not going directly to communities or directly to the ministries or to those that know best how to apply that money to go farther, to go longer. I just had a conversation about this exact problem in the last 24 hours about addressing the number of dollars and administrative costs lost because the funding is going to the wrong place and is being dictated by somebody who doesn't understand how to make that money go farther and longer. And so I think that it's a realization that if we start to go behind, if we go and we ask, what do you need? How can we help? And how do we accompany you in this journey financially, with technical capacity, but not come in with our solutions? It goes a lot farther. That's a core principle of the way Seed Global Health works, is that we go long-term, we go in partnership, we go and very much towards working the priorities that the countries have outlined as being critical. And I think another colleague of Minister Demi, my Minister Chapanda of Malawi, is the first to say, why can't you just fund my single national plan for health? One budget, one plan, one system of metrics and reporting. You would save me time, money, and I could do more for my people. Why not? Because again, we go back to the way that we're structured and the global north dictates and all of these dynamics have existed for a long time. And so it takes a reorientation and it takes the courage to say, we're not doing it right. Let's try something else. Let's iterate it. Let's, and I think that the moment for us to really change that is now. And for those of you that have examples of that kind of working in communities and behind communities, tell it. Please tell it, because we also aren't spending the time to share these stories in the right way or enough or to the right audiences, and get creative. I hate to say it, but marketing and communications is almost as important as the work you're doing. Otherwise, it gets lost in this information age where things get siloed. So we need to really tell those stories too, because I think that communication can go a long way to helping us scale.
We're just about wrapping up on time, but I guess looking towards the future, how do you define success in the climate change and health space? What goals should we be setting? How can people get involved?
Success to me in the climate change and health space is understanding that climate change is the single greatest threat to our humanity and sort of everything that we hold dear, or our world order, or whatever you want. It is the threat at this point. Everything is under assault from what's happening in climate change. And so success to me is that recognition would be lovely. I think a really thoughtful but aggressive phase out of fossil fuels, which means just transitions, right? We have to recognize a lot of communities, you can't just cut off the fossil fuels tomorrow because then they don't have any energy. But those of us that are the biggest emitters, those countries that have the capability, the investment, the resources to quickly transition, need to be very aggressive in doing so and making sure that we're making that shift. That is success. I think success, and I'll come through my health bias, is recognizing the importance of health in this and the deep need to put health first and to really demonstrate the cascade of benefit that comes from that. But then that's incumbent on everybody in this room, the community that's watching this remotely, and who you engage. For the academics, we need to be asking the questions that are being driven by our partners, answering those questions, and then thinking about how do we translate that into action and change, right? Not just, and unfortunately, a lot of the academic system is set up that if you answer a question, you can't go fix it because then there isn't another question to answer, right? And get another grant for, and so the system's a little bit broken. So we need to be pushing that. Academics, you need to start to recognize the promotion pathway for people who are doing, not just studying. That's a real crisis. Otherwise, we sit in an ivory tower of knowledge, and we're not actually implementing, and we're not actually taking that knowledge and making sure that it is translating into saving lives and true change. For the philanthropists, you have the ability to close the funding gap very quickly because you can leverage flexible funding that your partners in the communities can use in the way they know best to actually demonstrate the pilots, demonstrate the change that needs to happen, and then go get the big money that's locked in the bureaucracy that can then bring things to scale. But that's what philanthropy can do with flexible financing. For the metrics and evaluation we use can't just be the lives saved, but we need to think about how it becomes economic, social, security, and broader benefits of our society so that health rises in primacy. For the students, be audacious, fight for what you believe in, and get deeply involved in this change, and don't settle for the crappy leadership you see today. Because honestly, it's not acceptable what's happening, and it is a generational divide. So to have you studying this and doing this work and on this stage and asking these questions and being engaged and being a community health worker gives me the utmost hope of what success can look like. And so I thank you, but I ask you to get you and your colleagues and everybody involved. And I'm not letting the senior citizens world off the hook either. You got to change too. And you are the leaders, but success is more than possible, but it is having the courage to shake up where we are today and to know that things can be different and to think very, very pragmatically, but ambitiously and with honor about what we need to do. Thank you.
Yeah, thank you so much. Round of applause for that. I want to I want to take one quick second. I think change also happens locally, impact happens locally, and I want to thank Dr. Ivers, Dr. Stock for helping support climate change and health education here on campus. I've been fortunate enough to take Dr. Kari Nadeau's climate change and health class focusing on policy solutions this semester. Dr. Kerry came to speak to this course. Dr. Aniki Heron-Tabibi is also here, and I took her environment, health, and justice class as a sophomore, and that's what actually brought me into this space. And I see other fellow educators here as well. So thank you all so much for making this possible. And I think that's so important to funneling this forward into the future.
I want to double down on that because I think you're right. I'm really grateful to Harvard and to you, Louise, especially for bringing this whole agenda together. But I think that this kind of leadership is needed. So I want to also double down and express my gratitude. Thank you.